So we set out to create a really different experience here as a GP clinic. We realised that, it can be quite scary sometimes going to a doctor for various reasons, can be apprehensive. We wanted to make this a really inviting atmosphere with the garden in the middle here, the courtyard, which has a tranquil sort of feel, and at the centre of all the consult rooms, so people can look out and just feel that sense of peace when they're here with their doctor, through to the sort of non-clinical waiting area with our fish and our bookstore out the front, and just little touches that help that experience to be a little bit more inviting. And then I think just the whole point of healthcare needs to evolve. We tend to have longer consultations. We look at the whole person. We try to provide a better insight into what's going on for you in your life, in your health and in your mental health, and have that time to really elaborate on some of those challenges you might be facing. So people deserve good quality care, and that's what we're trying to provide here. We don't always get it right, and we do still need to continue to improve our service, but overall we're really proud that we've come this far and we're continuing to shake up how primary care might be done. Typical consultation time in GP is probably 10 to 15 minutes. It's never enough to develop a really strong relationship with your patient, to understand everything that's going on for them. Patients' lives can be very complicated and very broad in terms of what they're going through. We really want to explore some of those challenges because that impacts your health. So if we have longer time, we can do more in a consult. It's amazing how quickly that time flies. Even if we have 30 minutes, even 1 hour, still there's so much going on for people. So just gives us that opportunity to explore things in a little bit more depth, saves the person having to come back time and time again just to go through each thing, and not having to repeat themselves. So yeah, traditionally you grow up from the moment you're born throughout your life with this one doctor that you connect with, and that's a great model of care. We know times are changing and doctors may not be working as many days and are less available now than maybe what they were. So we're trying to provide a really collaborative approach, working together with our front of house healthcare assistants, our nurses and our GPs, so that if you come, you get a fairly similar experience each time, and you get to know maybe a couple of doctors, or you get to know a few team members that make you feel connected still to our service. So, ideally if you can connect to one GP, that's a great thing, because it's an important part of your life and you share things that are really close to you. Finding a good GP is hard. You really need someone who you feel is listening to you, who's getting what you are struggling with, who's giving you the time to understand that and to work on goals with you that you feel are going to be helpful. So that's a tough thing. It's like finding a friend. It takes practice and time and maybe a few goes, but I think once you find that person, it's a great thing to have as an ally on your journey. Well, I realise that there's gaps in healthcare, and when you go to a GP, you might find that you have to go from one place to another just to get everything sorted. We're really trying to create a one-stop shop here where you can have things dealt with under the one roof, and that you feel like that team is talking to each other so that you don't have to repeat your story. It's so important that you have a team that work with you and that understand what's going on for you. So we're building that team here. We're also focusing on areas that might not get the care that is needed. So some of those gaps in healthcare, such as chronic pelvic pain and endometriosis, which we were fortunate to receive the federal government grant for, through to areas such as child adolescent mental health and developmental health. And then there's GPs that have special interests, including things like chronic health conditions, aged care, and mental health, women's health, and antenatal and pregnancy. Look, the sky's the limit for us, so we're happy to explore any area with people that they might need help for, and we get help if we need it as well to support them. We really don't want to be feeling like we're a business that rushes you through and you've got short sessions that you have to come back and repeat and follow up. We do value the importance of longer consultations, because that is how we're going to really get maximum value for your time here. we don't see ourselves as a clinic that operates on a fast, rapid model. We really want to provide longer time, high quality care. That's what people are seeking now, and all our lives have become busier and as a result more complicated because we're quite stressed and we have a lot of things going on in our lives. So people do need that extra time to work with them, and that's how this healthcare model works. We realise it's really difficult sometimes because you have to go from seeing a GP to then waiting for another appointment to see someone else, waiting again to see someone else, and it's sort of a bit of a time lag between things. So if we can speed things up and make it easier to come and have things done all in one session, that might be from going to a GP to seeing the pathologist here to have your blood taken, to the nurse or our diabetes educator to have a look at other parts of your health, or our psychologist who will help you with mental health. If we can try and link things together and then also collaborate with our multidisciplinary team meetings and our chronic disease management plans, then this is how we really think healthcare should progress in the future. And we see this sort of model being really important in primary healthcare, where everything is done in that one session, where you have that one hub that you go to for your support. The Garden name is actually a bit unique, and I mean, we didn't initially start with that as a plan. We started with something a bit more generic and then realised like there's so much more to healthcare. We need to make this different. That's how we came up with Garden. The Garden is such a tranquil place. It's a place that anyone can go into anywhere in the world if they are needing some space, some peace, some time out, and you always feel better going into a garden. And that's really our model of care. Is we want you to leave here feeling better in yourself. The garden is also, if you look back into history, has healing properties. As you know, we used to draw on plants for medicine. So, you know, in a sense, it's a very historical setting and a place that we used to use in healthcare as a healing place. It's got tradition as well as being a modern, tranquil environment.